Hi, I'm Dr. Kim. Welcome back to my channel. I help people with chronic low back pain heal it from home. To this day, I have helped over 4,000 people. Today, I have a very special guest with me, one of my clients, Kevin. Trust me, you're going to want to stick around for all of this interview because his story is absolutely miraculous. So, Kevin, can you briefly describe who you are and what you do?
My name is Kevin. I'm a retired corporate executive living here in Chicago, here in the United States. Currently, I do nothing but consulting work on a very part-time basis.
Awesome. So, can you share a little bit more about the state of your body before you met me?
Oh, it was a mess. I spent the last 4 years having, depending on the day, being able to walk without losing my balance was a challenge because of an athletic injury that I had that I believe was because of hip rotation that caused me to have some kind of damage in my low back. But yet I went all over the place to try to get a diagnosis and was not getting anything. And then as a result of that lack of balance, took a very severe, violent fall, broke my right hip, tore the labrum in my left hip, and had surgery to replace the right hip and a repair on the labrum to repair that torn muscle on the following year. So not only did I have recoup of that, but I still was trying to recoup from the back injury. My quality of life, Kim, was horrible.
Yes. And I also know that you were having some issues with your feet as well. Can you talk about that?
Well, many, many years ago, as a young man, I was diagnosed with multiple sclerosis. About 5 years after being diagnosed, my feet started first at the bottom of my feet and then worked its way up to about mid calves, where I was losing the feeling in my feet. It felt like I was walking on pillows constantly, which also affected my balance. But I was told that, oh, that's the way MS goes, and that's just something you're going to have to live with because we have no cure and no treatment for MS.
Mm. Yes, that is so unfortunate that you were told that. And I'm so sorry to hear about all of the difficulties you've had in your past. It cannot have been fun. So we've been coaching together for a few months now.
Yes.
Can you describe the state of your body now?
Well, as you well know, Kim, but I'll share with everybody else here, that first and foremost, that as I started doing the program as you laid it out to me very specifically, um, I, I it still boggles my mind that this happened because I had been decades with having my feet having very little feeling, compromising my excuse me, my balance and walking because of that. And I started to regain feeling back in my feet because after doing some of the exercises that we had been that you had instructed me to do, I was shocked because again, MS is a neurological disease. There's not supposed to be a change once your body gets attacked like that. And I started getting feeling back in my feet again after those exercises, which obviously leads one to believe that that was a physical problem that caused the numbness in my feet and not a neurological problem. That was win number one, huge. The other is as I continued through the program, as I took advantage of meeting with you weekly, um, having you watch how I walked, watching how I'm doing the exercises, giving me pointers in regards to the way I was holding myself during the exercises and that type of thing to maximize the impact. Um, my back pain has gone from being searing back pain to just a low dull ache. My walk is starting to get more like a normal walking gait as opposed to being a limp, as opposed to being unsteady. So as we work through it, and we're continuing to work together as we work through it, I'm getting stronger, I'm getting steadier.
That is so amazing. And it's honestly been such a joy to actually visually see the changes in you over this time period. So, so,
Oh
so
God,
good.
it has been it has been nothing short of miraculous, and I ran into you strictly by accident online, and I was a skeptic, so I I couldn't thank you enough at this point.
Oh, you're so welcome. And sometimes it is divine intervention. Now, what
Absolutely.
methods had you tried previously before meeting me?
Well, I had been through weeks and weeks of physical therapy after both my hip surgeries. I had been through chiropractic treatments as well. I have been to neurosurgeons. I mean, we have some of the finest medical facilities in the world in Chicago. But our medical system is one that they're so paranoid and so happy that as I went to as an example, when I went to the physio, they were given a program laid out by the doctor as to how to have me recover from my hips. When I told them that my lower back was hurting, well, we can't worry about that right now. We've got to concentrate only on the hips. So they stuck only to the capsulized program that they were given. There was no flexibility to look at anything else going on, or maybe a cause and effect between the two. So between physical therapy, between neurosurgery, I've had constant MRIs up and down my entire spine. They keep telling me you've got the spine of a 20-year-old, that there is no issues in the spine itself. So it was immensely frustrating to not get an answer.
Mm-hmm. Yeah, yeah, I can totally understand that for sure. And now, what does the process for healing your back look like on a day-to-day basis now?
I spend probably the first 20 minutes of every morning going through the various exercises that we've laid out. They are not difficult. They can be done in an encapsulated piece of the start of my day. And there are times when I do them sometimes twice a day, both morning and evening. But at the very least, I made the commitment to do that at least once per day. So, in a 15 to 20-minute investment every day, it's paid huge dividends already for me.
That is awesome. And based on the results you've had so far,
Mhm.
where do you think you will be in another 6 to 12 months' time?
Oh, I'm going to be dangerous. I mean, I really am going to be dangerous because I'm for someone who's 68 years old, I'm extremely active. And I haven't been the last 4 years because of this injury and not being able to find an answer to it. So I'm going to be back in the gym lifting again heavily. I'm going to be back as I was a runner before 4 years ago. I want to get back into that again. At the very least, if I don't run, I'm going to bike. So, oh yeah, it's going to be back into, like I said, I'm going to be dangerous. I'm going to be as active as you can get your hands on.
I fully believe you, and I want to interview you again once you get there. And we need the video and photo proof of you doing all these things.
Exactly.
Would be
Exactly, Kim.
awesome.
Again, it's been such a change in the quality of my life, thanks to what you have led me to.
Oh, so beautiful. No, thank you so much. It's been such a pleasure. And I know that hiring an online back pain coach just sounds crazy and risky. Did you have any misconceptions or doubts about this process?
Oh, heck yes. And I'll tell you why. I mean, I come from corporate America. I was an executive running a large company. If I didn't perform, what I said meant nothing. If I didn't perform and deliver the results, I was not going to eat. I was not going to work. I was not going to continue to be accepted by the board of directors to continue to lead the company. So I come from a very pragmatic and skeptical environment to begin with, professionally. So I have a degree of skepticism that I put everything through when it comes to people telling me, here's what I'm going to do for you. Um, I ran into you by accident, but for whatever reason, Kim, your presentation, and then when I did take advantage of your one-on-one introductory session, you had me totally right then and there, based on your intelligence, your presentation, and your ability to talk more on a results-driven basis as opposed to just fluff.
Thank you so much. And I am so happy that I met you. Like you have been an amazing person and client, and you have been so dedicated to this process. And yes, it takes time and consistency, but you really committed, and that's why you got the results that you got, and are still getting them to this day.
Well, and you said in one of your posts that you need to show up every day. You
Mm-hmm.
need to show up and take advantage of what the knowledge that you're giving and the guidance that you're giving. And I can say, as a perfect example, if you do that, it will work.
I love that. So, if others are on the fence about getting an online back pain coach or working with me in particular,
Mhm.
what would you tell them?
I would tell them that absolutely positively to take advantage of your introductory meet and greet and your session with them. They have nothing to lose. They have nothing to lose and everything to gain. And if you've had that much of your life of suffering, and your quality of life is that bad because of the pain that you're experiencing, and maybe you've experienced it for quite some period of time, what are you going to lose by one introductory session with you?
Yes.
So there's no risk. There is no risk.
Mm-hmm. Agree. And at the moment, I am offering those introductory sessions completely free of charge.
Right.
So, yes, if you are on the fence about it, please just take the chance. Come meet me, say hi, and we'll see what we can do.
Absolutely.
Awesome. And Kevin, any final thoughts to share with everyone?
Well, that sometimes you can go through life and find your answers in places that you never expected. This was one of them for me. And your your web presence is your quiet light. You have been my loud light in my life, Kim, and I can't show my appreciation enough with the change that you've made in my life with my wife, and my life as a whole. So thank you.
Yes. You are so welcome, Kevin. Thank you so much for agreeing to be on this interview. And I know that what you have to say is going to reach the right people. So thank you again.
You're very welcome.